And we're back now with Sunday House Call. Imagine cutting in half the time it takes for a wound to heal. That's what researchers are hoping will happen with a new type of therapy called nanotechnology. We start with Dr. Siegel. I know, fancy term, Dr. Siegel. What is it? Sounds like hocus pocus. I mean, if I get a wound, it's a boo-boo. I just kiss it, make it better, and I use like Neosporin or Bactobran or something.
Eric, if you kiss your wound, you're going to get more bacteria in it. So I really hope you don't kiss it. But what you have to understand is that especially diabetics have a problem with wound healing. And post-surgical, of course, we want our wounds to heal. But it turns out there's this enzyme called Fidgetin-2, a technical term. This enzyme stops your rescue workers from coming to heal the wound. It stops your white blood cells. It stops your immune system. It stops the good skin from coming to form over. So now scientists have figured out a genetic way to block that bad enzyme from forming. And they take this treatment and they package it up in nanoparticles, which means microscopic, Eric. That's what you want to know what it is. It's a microscopic particle that gets right to the source of the wound and heals it. Now, your next question, I anticipate, which is you want to know when this is going to be in the doctor's office.
Yeah, can I go down to CVS
and get... It's past mice. It's past human tissue. It's going to go to pigs now, which David will tell you we use in medical school to teach us how to sew. I failed that. That's why he's a surgeon and I'm not. But from pigs, it'll get to the doctor's office a few years away.
All right, so Dr. Samadi, what is it? I mean, you can go to the shelf, and is it like a Band-Aid? Is it a thing? You put it on the skin? What exactly is it?
Think about nanotechnology as something that's almost at the level of a cell. It's 10 to the -9 size, something that you would never be able to see with the naked eye. Nanotechnology is a very, very hot field. And for a lot of people who want to make money in the future, pay attention to
what is it?
We don't care about stocks and all this stuff. We don't know what it is.
Do you go to the shelf and you put it on your skin like a Band-Aid? How does this make the wound heal?
The way it works is the vehicle that's going to be in the area that can bring more blood flow, more of the cells to do healing.
A cream or a salve or a salve?
Well, right now we'll see how it's going to pan out. Right now it's all investigation, and right now it's a clinical trial. As Mark said, it's in mice, and it's going to go to pig. So we'll see how it's going to pan out. But nanotechnology is good for treatment of diabetes in the future. It's going to deliver chemotherapy right at the cells. So these are vehicles that can be put in. We can give you an injection, and those nanotechnology can really go in and be directed to the areas where they have to go. So for diabetes, for healing, for chemotherapy, for cancers, it's really the way of future.
Like it can be an injection if you get a wound, and that'll make the wound heal faster.
That's right. Based on this study that's coming from Einstein, it basically inhibits those cells that delay wound healing and by half. So this is all part of the study. And as part of it reduces inflammation.
All right, not there yet, so wait till we get it on the shelves.
It's not going to be on the shelf.
Yeah, you have to wait for your boo-boo to be fixed.
Still kissing it.
I love the fact that Eric is always looking for a quick fix.
What did you say, Dr. Mark, very quick?
Eric, it's in the movie Hunger Games, but it's not yet on the shelves.
All right.
They use it in science fiction, but it isn't ready for prime time yet.
All right, we'll wait till it's fat. All right,
thank you.
His boo-boo is waiting.